I'm going to tell you my why so you understand, if you haven't met me yet, who I am and why I'm doing this. So I am Dr. Kelly Casperson. I grew up in Minnesota and I went to medical school in Minnesota, and I was trying to decide between emergency, OB-GYN, and urology. Those were my top three in medical school. And I realized emergency medicine was like rare trauma and mostly social ills and colds. And I was like, I don't think so. I also don't like working a lot at night. See also OB. Babies like to come at night. Miracle of birth is amazing, but I didn't want to work at 2 a.m. all the time. Also, the social ills that I see in gynecology, I'm glad I don't have to see them all the time. So urology truly saved my soul, I think. And did urology, trained in Denver for 6 years for urology surgery training. For people who don't know what a urologist is the surgeon of the genital urinary organs, stereotypically of the male genital urinary organs. All genders, kidney, all genders, bladder. But really the male sexual function, male hormones, male genital urinary structures. So experts of the scrotum, testicles, penis, prostate. Really thinking for a long time that the gynecologists were trained, like somebody's taking care of the women, right? And that was a wake up. So in residency training, I actually when I was interviewing in Denver, where I ended up going, they said, well, what fellowship are you going to do? So fellowship's an extra years on to your training. And they're like, well, you're going to have to do a fellowship if you don't want to deal with the women. And it was very unspoken, but what wasn't spoken is that women are complicated, women are difficult, women just want to talk too much. And as a minority in surgery, let alone urology, so currently, and I trained 20 years ago, currently 11% of urologists in the United States of America are female. So they're like, well, because you're a woman, all you're going to get is women. So I lied and said I was going to do a fellowship, but I didn't end up doing a fellowship. About 70% of my practice is female. So did urology training, stereotypical male sexual health, thought the gynecologists were taking care of the women, and was about 7 years into training. I live in Washington State. And a woman I was very bonded with came in and was crying about her lack of desire, pain with sex, sexless marriage. Good relationship. Sexless marriage. And as I was handing her a box of Kleenex, this was 7 years ago. So 7 years out of training, 5 years ago. And handing her like the box of Kleenex, watching the lightning strike my head of like, you don't know how to help her. And then I was like, well, does anybody know how to help her? Because I remember from training them saying women are difficult, we don't know about them, and gynecologists are taking care of them anyways. And I was like, 7 years later, I'm like, is this true? Do we know anything? What are the gynecologists doing, right? And that was really the beginning of my education into female sexual health. In medicine, we don't tend to talk about health, we talk about dysfunction. So female sexual dysfunction. I would say female sexual optimization might be a nicer term. And started going to the International Society for the Study of Women's Sexual Health, which is ISHWISH for anybody who's interested. If you are a sex therapist, physical therapist, nurse practitioner, PA, physician, great training on female sexual health from ISHWISH. And started learning a lot, reading all the books, like an entire bookcase over here of books. And started being like, the books are two types. Very academic, narrow margins, lots of copy, dense. That's one type. And then the other type is fishnet stockings, stilettos, red lipstick, like just a kind of a persona or a caricature of what sexy is. And I was like, well, a lot of people don't want to read these and a lot of people can't read these. So I'm going to write what makes sense to me, which is approachable, friendly, educated, empowered. And that's the book. But prior to the book, I started the You Are Not Broken podcast. So I've been podcasting for a while by the time that the book came out. And I didn't do the traditional publishing way because I was in a hurry and I'm like, you gotta find an agent, you gotta do a pitch, you gotta like freaking write the book before anybody commits to you. And I'm like, it's gonna take too long. This book needs to come out now. So I did a hybrid, kind of self-publishing hybrid thing like 3 or 4 years ago with this book. And a publishing company found me maybe like a year ago and was like, will you write a book? This is how it went. They're like, will you write another book about sex? And I was like, I think my next book's going to be about hormones and menopause. And they're like, yeah, that's fine. Write that book. And can we buy your current book? So that's awesome. Got into hormones because of sex, because I started educating people about female sex ed. And they're like, yeah, but you know what happens with menopause. Yeah, you know what happens with menopause. And I'm like, what happens with menopause? And they're like, your sex life goes away. And I'm like, well, is that true? Right. And really started investigating the role of hormones, because there's a good subset of people who say my sex life didn't get good until I was 55. It didn't get good until I was 60. And we can talk about that. So you got this dichotomy. You've got this like, never had better sex in my life. And I stopped having sex 8 years ago because of menopause, right? And so really dived into, I already knew a lot about genital urinary syndrome of menopause and vaginal dryness and the role of vaginal estrogen, and already really had been prescribing that a lot in my practice, but had not done anything as far as systemic, which means in your body, not just in your vagina, systemic hormones for women. And very comfortable with testosterone for men because urologists prescribe testosterone for men every day. So I was already very comfortable with male systemic hormones and female localized hormones, and started reading about the role of hormones on desire. And it's not just testosterone, it's testosterone and estrogen, and it's not the same for everybody. And started to be like, why is everybody so scared? Why is everybody so scared of hormones? Where is this coming from? Okay, it's coming from the Women's Health Initiative published in 2002, 22 years ago. And I'm like, okay, why are they so scared of that? What happened then? What did it say? Oh, it said that hormones cause breast cancer. Is that true? No, it's not true, but people don't know that. And so really started to dive into hormones and be like, oh my God, here I am talking about this like extra thing, which is like sex doesn't exist in a vacuum. If you feel shitty and you're not sleeping and you have night sweats and your mood's crazy because of your hormone, number one, fluctuating, or number two, being zero, you don't have desire for sex because you feel shitty. And there was this paper, and it was basically like, women after menopause stop having sex for 2 reasons. Number one, availability of partner. And I always joke, I'm like, I can't help people with that. But number two is systemic vasomotor symptoms of menopause. So poor sleep, hot flashes, night sweats, mood changes, your body changes, distribution of fat changes, affects body image, right? Let alone the genital urinary syndrome of menopause. So the changes on the pelvis, the vulva, the clitoris, the labia, the vagina, that happens because your testosterone and your estrogen go low. So started learning about hormones, and I'm like, I can't talk about sex without talking about hormones. And ISWISH, International Society for the Study of Women's Sexual Health, always talks about sex being biopsychosocial. And I'm like, this word is long. This word is stupid. I don't know what this word means. Why are people trying to make sex complicated? And I'm like, well, because sex is actually very complicated. And I was 2 or 3 years ago preparing a TEDx talk. If you want to watch it, it's called Why Adults Need Sex Ed, and you can go on YouTube. If you're typing Casperson TEDx, it'll pop up. And I was like writing that talk, and like, what am I going to talk about? What do I want people to know? And I'm like, damn it, that's biopsychosocial. Biopsychosocial. So the TED talk ended up being about biopsychosocial. And I really think that's what this book is about, because so much of adult sex ed, if you look at the internet or Hollywood, right? It's like, just buy a different vibrator, get a different lube, wear something sexy, try a candle. Like, it's all this like action-oriented behavior. And I would argue that doesn't, like, oh, turns out I just needed to dim the lights. And no, like, if we don't dig into the psychosocial, which we never got taught in sex ed, biology, which is the bio, which is hormones, I started realizing I can get your vagina perfect. I can get you to have an erection. I can give you Viagra. I can get your hormones dialed in so you're not having night sweats, anger issues, all that stuff. I can dial all the biology in because I'm a physician and I can prescribe, and physicians are biologically trained. But if your brain's not right about sex, what good is a healthy pelvis, right? And so that's really where me being like, but how do you affect the brain? How do you get people to see their thoughts about sex? How do you get people to see what they're believing about themselves, about their body, about their worthiness, about their partner, about what society told them is okay and is not okay in regards to sexual health? How do you get them to speak up if they're in a partnership that has unequal distribution of work at home or poor communication skills? You can't have a great sex life without addressing the psychosocial in the biopsychosocial. And that, my friends, is why this topic is amazing. Because it's not only your body, which will inevitably age, which will inevitably have issues with it, even if it's just like a knee injury, right? With your partner's body, which will inevitably age unless you change partners, which will inevitably have issues. 40% of men have erectile dysfunction by age 40, my friends. Men have biologic issues too. Also low testosterone, which can affect libido. So bio, psycho, social. Psycho is your thoughts. What do you think about sex? Do you think you're deserving of feeling pleasure? Do you think you're deserving of receiving pleasure? What do you think about speaking up about sex? What do you think about talking to your partner about sex? I'm just throwing a bunch of questions at you, but all of those thoughts, right? The thoughts that we have, what do we think about women who like sex? How do we judge them? If we judge them, then do we judge ourselves when we look at what you're worthy of, right? So it's all of this psychological stuff. And that's really where coaching comes from, helping you see what your thoughts are about something, where your limited beliefs